Hello, my name is Tammy Caldwell. I'm a registered nurse at Holmes County Hospital in Lexington, but I'm going to school at University in Jackson. I'm in the nurse educator program, and Miss Allison Schuler is my preceptor, and we have together worked on a patient safety project, and we chose PICC Line Care. So I'm going to get you to take a quick pre-test, and we'll quickly go over it, and then we'll start the presentation. Don't be scared if you get it wrong. We're going to go over it. Alright, we're ready? Okay. Alright, number 1 is B. Number 2 is C. Number 3 is D. It's both A and D. Number 4 is D, A and D. And number 5 is B. So I'll just pass those up. Okay. Like I said, we have chosen PICC Line Care as our patient safety project with the use of antimicrobial sponges. This is something well, they've been using it for a few years, but not a lot of hospitals use it. I think it's more in the bigger hospitals, and they're kind of branching out to the more rural areas, trying to get it to, trying to get everybody to start using these to prevent PICC line infections or catheter-related bloodstream infections. The objectives of this presentation, we're going to define what antimicrobial sponges are and how they're used or why they're used in clinical practice. Also, we're going to explain how it works, and how they work generally and how they work in reducing infections. And then we're also going to identify the risks and benefits related to the sponges. Basically, the definition of an antimicrobial sponge is that it is a sponge that has antimicrobial agents that include, there's only about 3 of them, but they are chlorhexidine gluconate, ionic silver, and then polyhexamethylene biguanides. And basically, it just kills off harmful organisms around the site, or that's what it's used for. And those, like I said, are the only 3 that I've been able to find so far. And real quickly, we're just going to kind of go over the steps that y'all use here at Monfort Jones for PICC Line Care, as far as cleaning and how you change it and everything. So initially, it is a sterile procedure, so you will use sterile gloves. And y'all are lucky because y'all have a kit that all of this stuff comes in. Not other places are so lucky. We have to go and find everything. So wonderful little kit. The dressings are to be changed every 7 days here. Per your policy, and that is unless it gets soiled, loose, or becomes damp. So first off, you just want to tell your patient what you're going to do, and also, of course, wash your hands. We love hand hygiene. And then, if I'm not mistaken, there's a mask included in your kit, and you'll put your mask on before you ever glove up for the sterile changing. Then using non-sterile gloves, you will remove the old dressing, and sometimes you may have to get some alcohol preps to kind of pull the dressing away so it doesn't pull on the actual PICC line. Then once you've got the old tegaderm off, you want to assess the site. You want to look around the catheter insertion. You want to look up the arm to the shoulder, around the neck. You want to palpate a little bit for like any tenderness, and if they complain of any tenderness, tingling, any burning, any redness or swelling noted, or any pain, you want to cover the dressing with some cereal gauze, and then you want to let the doctor know what's going on, because they may need to have it removed or replaced. It may have dislodged, and they need to know about that. If it looks like it's going to flop and flip around, you can secure it with a little piece of removable tape. Paper tape is what we've used before, and that tends to help secure it so it doesn't, while you're trying to get your stuff done and they happen to move their arm, it won't dislodge it. Once you've got it semi-secured and you feel like you're ready, you'll discard the regular non-sterile gloves and you'll set up your sterile field. And it's just like Foley catheter, same way. You just make sure you don't get your hands all in it. And then you'll apply, once you get your sterile gloves on, you're going to measure from the insertion site to the hub to see what the sonometer length is. If it's longer than what they have documented whenever they put it in, then of course you know that there's some dislodgement there, and that may be a cause for maybe have to take it out, or the doctor needs to know the man will leave it in, be okay, but he still needs to. And so that if somebody else changes it and it's longer, then you know that something's going on. Let's see, then you're going to go, once you've got that done, you're going to go ahead and do your cleaning, and y'all have ChloraPrep in your kits. So you're going to open your ChloraPrep, and you're going to go in a circular motion starting from the insertion site, working your way out about 3 inches. Normally the hub is around 3 inches, but you still want to actually get the hub also, just to clean it so it can have some type of disinfectant on it. Then you allow the site to completely dry. This lasts anywhere from 30 seconds to a minute, but it has to be completely dry so that you can actually, so your stuff would actually adhere to the skin. Then you're going to apply your stat lock. Your stat lock is, you're going to put it on first before you secure it to the skin, so that you'll, so it will be in place, and that whenever you put your tegaderm on, the insertion site won't be at risk for slipping back. Then here y'all have a tegaderm type dressing, so you'll apply your dressing. You want to make sure that it covers, that the insertion site is visible with the tegaderm, and then you also want to make sure that the hub is covered so it will secure it to the skin a lot better. And then you want to label your dressing. Here y'all do the date and your initial, and then what type of line it is, whether it's midline, subclavian. Some people put the time, just kind of, you know, however you feel the need to do that. But here's just the date and your initial and what kind it is. If the linens are kind of loose, or they look like they're going to flop, you can have some, you can put a piece of tape on the outside to secure it down so they won't flip and flop. And then also you want to make sure that each lumen is capped with a positive pressure cap, so they won't get any air in it. And the caps are to be changed anytime there's a TPN administration, which I don't think y'all do TPN here. But in the event that it happens and y'all do it, you have to change it with every TPN administration, any blood collections, and then also every 3 days. So just maybe want to kind of coordinate a little bit. Okay, so why antimicrobial sponges? According to some studies, healthcare associated bloodstream infections, increased antibiotic exposure, mortality, morbidity, the length of stay in the hospitals for patients, use of healthcare services. This affects about 10% of the population. Doesn't sound like a lot, but when you have like a lot of people, that 10% adds up. These infections are preventable, and it's estimated that 250,000 patients in the U.S. obtain bloodstream infections or catheter-related bloodstream infections from our PICC lines and central venous catheters. Chlorhexidine is the main thing that's used as a topical anesthetic, and it's been used since around the 1950s. It's getting a little bit more notice as far as actual like with IVs, ports, PICC lines, central venous catheters, as far as keeping it clean, keeping the area not technically sterile, but keeping it where there's to kill all the microorganisms that grow on any of the lines and the port sites. It has been clinically proven to reduce bloodstream infections. There's been a bunch of meta-analysis completed, tests, things that have proven that it does have some effect with killing the infection or microorganisms that collect around the insertion sites. Let's see, it does, and also reduces the effect of catheter colonization, which again is around the insertion site. Everything's mostly around the insertion site. Okay. How does it work? Well, it works by reducing the external lumen route of infection, which most infections occur from 3 ways. It's usually at insertion point, when they actually do the insertion. It occurs from microorganisms coming down the line and under the tegaderm and to the insertion site. That's one way, and then also the catheter hub contamination. So with the chlorhexidine and the onyx silver and the PHMB, they have broad antimicrobial properties which help kill off broad spectrum organisms. So they're kind of, which include staph, enterococci, and pseudomonas. So they're really broad spectrum, and they kind of hit on all aspects, and even some antifungal properties. So that some of the ones that, if they get like yeast or something underneath there, then it'll actually help with that also. They do have a sustained antimicrobial action, which means that once it's on there, it releases a little bit every now and then, well, throughout the days, I guess, and it lasts from about 7 to 10 days, so that you can have, you can leave them on longer. They don't have to change the dressing as often. And then they're also highly absorptive. If there's any kind of discharge or drainage from around the insertion site, any bleeding, if they start having any kind of exudate or anything that comes out of it, then the foam actually acts as an absorber. It's made with polyurethane, and so that whenever anything comes out, it just kind of goes up in it, and it also helps control any overgrowth of bacteria, and also aids in the healing process. And I have a quick video. Hopefully it'll work. That just shows you how.
I'm going to demonstrate how to change the PICC line dressing. Before you start, you must gather all the supplies needed. Explain the procedure to patient, then remember to wash your hands with warm water and soap for 15 to 20 seconds. Then check your patient's ID band. These are the supplies we need: non-sterile gloves, 2 masks, 1 for you and 1 for the patient, a stat lock device, sterile gloves, and a central line dressing change kit. The first step is don non-sterile gloves and remove old dressing and stat lock. To remove the transparent dressing safely on the patient, just stabilize our PICC line, then pull the dressing gently towards the insertion site. Ensure that non-sterile gloves do not come in contact with the catheter. In some cases, you might need an adhesive remover. After dressing has been removed, assess the patient's site for erythema, signs and symptoms of infections, edema, breakage, or leakage. Remove all gloves and wash hands. Don masks. Open such a line kit and create a sterile field. To open the dressing kit, only touch the outer edges, and you're going to drop the stat lock and what other supplies you need in your sterile field. Don your sterile gloves. With your dominant hand, touch the inside part of the glove and put it on. And then you want to reach out for the next glove, now touching the outside part, and put it on. If the area surrounding the insertion site appears soiled, use alcohol swab sticks to remove debris or old blood. Carefully cleanse area from insertion site out in a circular fashion, approximately a 3-inch diameter. Then discard the sticks and make sure you use all total 3 of them. Then you want to activate the chlorhexidine by squeezing and shaking it until the sponge gets wet. On this step, you want to vigorously scrub from insertion side out, again in a circular fashion, covering all the way to the wing side of the catheter. Do not reswab and use swab sticks and chlorhexidine and go back mid-spot. This will introduce microorganisms. We also want to swab the surrounding area with skin prep for protection before placing the stat lock and tegaderm. Then wait to air dry the area. Do not fan or blow. Carefully place the stat lock. Before exposing adhesive backing, attach catheter wings to a sterile stat lock. Close hinge doors and press down until there is an audible click. Secure the stat lock by exposing the adhesive backing and positioning on the arm. Then apply BioPatch, the blue side up, by sliding the BioPatch with slit facing direction of tubing for easier removal during the next dressing change. Cover entire portion of catheter and stat lock with transparent dressing. This is to prevent microorganisms from migrating up catheter to insertion site. And please make note not to apply gauze under transparent dressing unless site is oozing or bleeding. If inflamed or with drainage, apply ChloraPrep and cover with gauze and change dressing daily. Notify the physician and parenteral services. Initial and date the dressing. Secure lumens with tape if necessary. Document site, appearance, interventions, and dressing change under IV assessment flow sheet. You may also want to measure the external length of the catheter to compare against the initial measurement by the PICC line nurse, and also measure the circumference of the arm, and again, compare with the PICC line nurse measurement, and it shouldn't be more than what the initial measurement was. And to measure the external length, count each dash mark, and each mark is in centimeter. And these conclude my demonstration. Thank you, and we'll see you on the skills day.
I chose this video. I went through a bunch of them. But this was the only one that actually would let you see the masks. The other ones that I looked at, they had, one of them had masks, one of them didn't. They were really, so this was about the best one that I could find. Let me get out of this real quick and I'll go. Now they also mentioned BioPatch. BioPatch is like it's just the main one that they're using. There are others. I don't want to try to sell a BioPatch. I just want to try to encourage the use of antimicrobial sponges, any of them, because they all tend to work. So some risks and benefits of using these. For the benefit side, they do decrease infection rates. According to one study, major catheter-related bloodstream infections were reduced by half. And then as far as the control, and then they used the I keep wanting to say calcium gluconate. That's not it. Chlorhexidine gluconate. That's what they used on both of their studies. The other one, it was reduced by about a little bit over half, and they did the colonization collections. So it did have some improvement as far as colonization at the insertion site. Also, it has, like I said earlier, it has the antiseptic release. It provides a consistent antiseptic over the 7 to 10 day range, so that it will help limit the skin from getting so irritated or causing any kind of skin tears or anything like that. So it limits skin breakdown also. Especially if they have any drainage and you have to constantly change it. So that also helps on that. It's also CDC recommended. As of 2011, the CDC recommended that that the antimicrobial sponges be used, specifically those loaded with the chlorhexidine gluconate, but only in patients older than 2 years of age. It also reduces cost. There was another study that was completed for treating treating the bloodstream infections, the catheter-related bloodstream infections, and it indicated that treating a catheter-related bloodstream infection would cost anywhere from $8,000 to $25,000 per person, and annually, if with the use of them, it would save around $257 million to $1.97 billion a year, kind of overall, not just one person, but overall of all the patients that would have had it. Also, it reduces the mortality rate. The discs could prevent around 329 to 3,609 patients from dying each year from catheter-related bloodstream infections. The risk side, they are expensive. I did find some that were about $3.50 each. Depends on where you get it, who you get it from, how you get it packaged, but they're anywhere from $3 to $11. They are a little bit cheaper in the kits. The kits are $9 each. And since y'all use kits here, that might be a better way to go for y'all, especially if you don't have them. If y'all don't have PICC lines a lot, I know where I work, we do not, so we get them very seldomly. But the $9 kit may be better off in the long run. But then you can also get some. I know with the silver infused sponges at a cheaper rate. You just have to kind of, it's kind of just pick and choose. Also, they're not approved for neonates, and some studies that were done using the chlorhexidine itself in the sponges, it caused irritation to the skin and caused some skin breakdown in the babies, and they said they attributed it to a lack of immune system. So that's why the CDC didn't want them using it on any children below the age of 2. The insertion site is not visible with the sponges, but the risks, the benefits kind of outweigh the risks. It helps absorb any kind of discharge. It does have an antiseptic effect, and it releases the medication over a 7 to 10 day period, so that if anything does come down the line, it should get picked up by the sponge. And then there's no effect on the hub. Well, the hubs are usually, per protocol, are supposed to also clean the hubs as well. The hub is usually not completely covered. They like it covered, but again, with any microorganisms that kind of come down the line, it should be picked up by the sponge. So those are just some risks and benefits. Do y'all have any questions or anything? Oh. All right, well, we're going to do a quick post test. Yeah, I know you had to go to school, did you? And then I'm also going to do give out an evaluation for y'all to evaluate the presentation and believe in me as well. So, there we go. And we'll go over the answers again too. You ready? Number 1 is B. Number 2 is C. Number 3 is D, both A and B. Number 4 is D, both A and B. And number 5 is B. We get hundreds that time? All right. All right, and this is just an evaluation. And it's pretty self-explanatory, but it's just rating me, rating the presentation as far as, the objectives, if we met the objectives or not. You can there. You don't have to sign. Unless you want to. And I'm not 100% sure as far as CEUs. My instructor will send my application off, but I don't know if it will apply to Monfort Jones. But I'm going to give y'all one of these little sheets just saying that you can anyway. And then in the event that it does go through, you'll have half hour CEU, or a half credit. So no questions or anything? Very good. Very good. Okay, thank y'all for